The 1960s and 70s were challenging times in America. In San Diego, the small community of San Ysidro was facing its own struggles. There was a great need for medical services. At the time, there was only one part-time doctor for 7,000 residents near the border. Family physicians, dentists, and pediatricians were greatly needed. But help was coming to San Ysidro. It would come through an unlikely source. A group of 7 mothers, or El Club de las Madres, would bring about change to their community. With limited English skills and education, the women would seek the help from Dr. Ruth Cavell at UCSD School of Medicine.
In the 60s, there was essentially no health services in San Ysidro. There was one physician who came in part-time into town, so there was really a huge need there, and San Ysidro was really being neglected.
Every element was critical, and the women's work would pay off by establishing the San Ysidro Health Center in this 2-bedroom casita in 1969. The San Ysidro Health Center has grown through the years. It recently held a ribbon-cutting ceremony for its new building, the Maternal and Child Health Center. It is a state-of-the-art facility and a one-stop shop where women and children can get all their medical services in one location.
What started with a vision from our founding mothers in a small 2-bedroom house is now a health center that serves the entire South Bay and Central San Diego with almost 700 employees and 20 care centers. So we've come from a small cottage to a regional care network.
At the new building, there's medical services like OBGYN, early childhood development, pediatric dentistry, to a brand new cocina or kitchen. These are just a few of the many medical services offered to the community throughout the region. While much has been accomplished, the work is far from over. With health care reform at the forefront in Washington, community health centers like San Ysidro are strategically poised for more change in the near future.
We're quite excited about the future, basically because we've offered the building blocks of reform, and that's a conveniently located medical home, primary care doctor with high quality, very cost effective.
What started out as a vision and a grassroots movement for the founding mothers has turned into a spirit of empowerment for the entire community that is still visible today.
Como esto fue un sueño que se hizo realidad en la clínica, yo me siento muy orgullosa. Nomás de ver ese edificio, de que fue tan chiquito, esa es la cosa que nosotros debemos de ver, que por algo se empieza, señora.
Pues me da mucho gusto. Digo, no lo puedo creer. Como dice el dicho, sí se puede. Sí se puede. Nunca pensamos que iba a llegar a esa magnitud tan bonita.
I think the founding mothers, as well as the community itself, should take great pride, because this really was a grassroots development. It was not a top-down development, it was grassroots. And without these people becoming activists and somehow they're empowering themselves, none of this would have happened.